Today's lecture will be with the brachial plexus and the three nerves, the median nerve, the radial nerve, and the musculocutaneous nerve, and their association with the muscles they innervate for the elbow joint. The first one we're going to look at is going to be the radial nerve. The radial nerve is important because it's formed from the posterior cord. And remember, the naming of the cord is going to be their relationships to the axillary artery. So the radial nerve is going to lie in the posterior side in relationship to the axillary artery. It's also part of the posterior division of the brachial plexus, and it's going to bring in the anterior rami or the spinal nerves of C5, C6, C7, C8, and T1. When we're looking at the musculocutaneous nerve here, again, it's going to be the musculocutaneous nerve is going to be formed from the lateral cord. And this time we're going to see that it's part of the anterior division. And then it's also going to bring in C5, C6, and C7 spinal nerves. And finally, the last one we'll look at is going to be the median nerve. So we come down here, the median nerve is going to start here. And the median nerve actually bifurcates or splits, but it's formed from two aspects. It's going to be formed, we'll just draw a line here, it's going to be formed from the lateral cord, and it's also, I'll draw a line going this way, it's going to be formed from the medial cord. So the median nerve is actually going to split or bifurcate and pick up the medial cord and the lateral cord, but the part of the median cord is going to be predominantly with the anterior division of the brachial plexus. So it comes up here and picks up the anterior division of the brachial plexus. And then we see the termination point is going to be with the median nerve is going to go from C6 all the way down to T1. So the first nerve that we'll look at will be the radial nerve. Again, it comes from the radial nerve is going to come from C5 through T1 spinal nerve. It's formed from the posterior cord. So you can see as it lies in relationship to the axillary artery. It's in the posterior aspect of the brachial plexus. It picks up the posterior cord. It's part of the posterior division. And it's going to terminate on its motor control on the triceps, the brachioradialis, portions of the supinator, the anconeus. It also does the sensations of the outside or posterior lateral forearm and the hand. So the first muscle that we'll look at is be the tricep brachii. All the heads are going to produce elbow extension. And with elbow extension, in the previous lecture we mentioned the olecranon process sitting into the olecranon fossa. So when we're looking at the long head is going to be here. So the long head is going to be right here. Its job is for extension of the shoulder joint. It can also do adduction of the shoulder joint and horizontal abduction. Its origin is slightly different. The long head is going to pick up the infraglenoid tubercle of the scapula. And the insertion points are all going to be the same, which is going to be the olecranon process of the ulna. The medial head, or the short head, or the lateral head, or medial, the short head or the lateral head of the tricep, the only difference between the two is their going to have a different origin site, and the origin for the lateral head or the short head is going to be the upper half or the posterior surface of the humerus. So the brachioradialis, we mentioned this before, but it does both the pronation and supination. It also aids in flexion of the elbow, and it particularly aids flexion in the elbow if the hand is in a slight pronated position. In weight training, we call this a hammer curl. But if the hand is in a slight pronated position, it's primarily going to be the prime mover for flexion of the elbow when we see the hand slightly in a pronated position. Its origin is on the condyloid or the supracondyloid ridge of the humerus here, and it's going to insert into the distal end of the radius at the styoid process of the radius. This is what allows it to do both pronation and supination. The supinator, the job is in the name. Its job is for supination. Whenever we have supination, we're going to have the origin, which is going to be fixed. So the origin is going to be portions of the humerus and the posterior side of the ulna. So we have a fixed position, and then the insertion will be pulling on the radius, going into supination. And the anconeus, it does extension of the elbow, but in particular it has a special function. The anconeus, if we look at the elbow joint is surrounded by a synovial membrane, and the anconeus prime function is to pull the synovial membrane of the elbow joint out of the way of the olecranon process during extension. So the attachment of the anconeus is going to pull the synovial membrane away, making room for when we see the olecranon process landing inside of the olecranon fossa. The next one is the median nerve. Again, it's portions of C6 through T1 spinal nerve. It's also located, it has that bifurcation or splitting, so it brings in not only the medial cord of the brachial plexus, but also the lateral cord, and it's consistent with the anterior division of the brachial plexus. And anterior, you can see how it's sitting on the anterior surface of the scapula. So some of the muscles that we're going to talk about are going to be the pronator teres, and we're also going to talk about pronator quadratus. So the first one is going to be the pronator teres. Again, when we're talking about pronation or supination, the origin is always going to land on a fixed portion. So in this case, it's going to be the medial side of the humerus here, and the medial condyloid ridge of the humerus, and the medial side of the proximal ulna. And then its insertion is going to be on the lateral surface of the radius. Its main job in bold here is going to be pronation of the forearm, but it also aids in weak flexion of the elbow. So it does allow for the pull of the radius in flexion. And then again, pronator quadratus, we go a little bit more distally. So the origin is going to be on the distal and anterior side of the ulna, and it's going to insert on the anterior side of the radius. Its job is to move the radius on the distal side, or provide rotation more distally for pronation. And finally, we have the musculocutaneous. It is formed from the lateral cord. So it's formed from the lateral cord. It's part of the anterior division. Again, we can see how it's running on the anterior surface of the subscapular fossa. And then it's going to articulate into the bicep brachii and the brachialis. Brachialis is the deeper of the two, so it's a shorter muscle. It lies just on the distal portion of the humerus and inserts onto the ulna. And then we talked about how bicep brachii is important for supination. So when we're looking at bicep brachii, it's going to have two origins. The first origin is going to be the coracoid process of the scapula, and we're also going to see the origin on the supraglenoid tubercle. So we have two origins, and the insertion is going to be on the radial tuberosity. And since this is on the radial tuberosity, this is what aids in supination of the forearm. It does provide weak flexion of the shoulder joint, so especially with the arm in a straight position, we see that the bicep is involved with the flexion of the shoulder joint. But remembering from the shoulder joint lecture, the majority of flexion of the shoulder joint comes from the anterior deltoid and the pec major. Its primary function is to do flexion of the elbow. So you can do flexion of the elbow and supination of the forearm at the same time, which involves the bicep brachii. And then finally we have the brachialis. I illustrated this a little bit earlier. It is the deepest of the two bicep muscle, and it's considered to be the true flexor. And when we talk about true flexion, earlier we talked about 0 to 20 degrees, and this is what the brachialis muscle is important for. So it provides the initial pull of the ulna on the anterior surface to allow the olecranon process to unlock from the olecranon fossa on the posterior surface. And this is the 0 to 20 degrees. So when we're talking about articulation or flexion of the elbow, it's going to first 0 to 20 degrees will come from the brachialis, and then the bicep brachii will continue to pull the elbow into 140 to 150 degrees. And that concludes the lecture on the brachial plexus and the muscles associated with the elbow joint.